September 30th marks National Day for Truth and Reconciliation. As we recognize survivors, their families, and communities, asking questions is a vital part of understanding history. Isaiah Beardy, Environmental Services Supervisor at Niagara Health, joins me in the studio. Isaiah, welcome.
Thank you for having me.
Isaiah helps to foster a welcoming space at Niagara Health and advocates for non-Indigenous Canadians to ask him questions. Isaiah, before we talk about your role at Niagara Health, can you please share your family tree?
So my family comes from Kingfisher Lake First Nations. We were originally situated in Saskatchewan, and then due to the fur trade, we moved to Northern Ontario to a flying community called Kingfisher Lake First Nations.
Visiting Kingfisher Lake in the summer when growing up, can you please describe the difference between a flying community versus living in Southern Ontario?
The difference between a flying community and Southern Ontario, like the main things I would say is when you go to a grocery store, you'll see high prices. There's not as much of a selection of produce and meats and stuff like that. So it turns into people having to do a lot of this stuff on their own. So fishing and hunting for food, some berry picking like my Nocum used to do. And some of the services that we've become accustomed to, such as immediate health care, fire services, education past grade 8, you just don't see much of. So it's different for sure.
You're a graduate of Niagara College. What brought you to the region and drew you to your field of study?
So I came to the region just due to being able to pave my own path. I didn't have really any connections here in Niagara. I went to Niagara College for border security. It is kind of unrelated to what I'm doing now, but it is a very broad program that I took. So from classes such as ethics, sociology, psychology, it gives you a broader education than other programs. So, and I just have been bringing that forth to my career now. So it's been really good.
You worked at the Welland site during the pandemic as a screener, and now you work in environmental services in St. Catharines and Niagara Falls. Can you please explain what the role of environmental services is and how important these services are to our communities?
We're some of the first people you see in the morning when you stay at the hospital. We clean your room. We're also so we're in charge of making sure that you have a nice sterile environment to heal in. We also are in charge of any linen leaving the hospital or coming into the hospital and all the sites. We also are very proud that we're able to do what we do and hopefully put a smile on people's faces when they're in a time of in a stressful situation in their life, being in the hospital, right?
You create a safe space for non-Indigenous Canadians to ask questions at Niagara Health without judgment. Can you please share what common questions you are asked?
I get a lot of questions regarding, I guess, symbolism, just like what medicine wheel means or stuff like different words. Stuff like that are the main questions I get asked.
You wear a medicine wheel on your beaded lanyard at work. Can you please share what this means?
A medicine wheel stands for a lot of things, just for what the meaning is. It can mean north, south, east, and west, just the 4 directions. It can also mean the 4 seasons. It also stands for our 4 sacred medicines, being tobacco, cedar, sweetgrass, and sage. And the reason I wear it is kind of to have a little piece of I guess home for Indigenous people that come into the hospital. Just something that they can see, and it's a little bit of representation for Indigenous people. It is also important to me to wear it because I believe that a medicine wheel is really good to have in a setting for medicine, such as the hospital. I think that there should be more representation of the medicine wheel within the health system, so that's why I wear it.
On September the 30th, how are you honoring National Day for Truth and Reconciliation?
I'll be wearing a orange shirt, hopefully answering questions for people that might have questions. So and I'll do it with a smile. Hopefully I'm able to answer it, and if I'm unable to answer it, I'll point you in the right direction.
Isaiah, thanks for being here today.
Thank
We
you
really
so
appreciate
much.
it.
Thank you so much.